Hospitals in England are treating more patients now than during the first wave peak back in April. Dr. Katie Sanderson is a junior doctor at a London hospital and a member of the Doctors Association UK, which campaigns on behalf of British doctors and the wider NHS. She spoke to us just before starting her night shift tonight. How bad are things at the moment?
So there's now more patients with the coronavirus in hospital in London than there were in the first wave. A lot of hospitals have very limited intensive care capacity, and certainly over the weekend and the bank holiday were under really extreme stress, with more very sick patients turning up than they could process in a timely way, with ambulances backing up that couldn't hand over their patients to accident and emergency departments because accident and emergency departments were full of patients who needed to be admitted to hospital but didn't have beds. And I think the fear is, if it's this bad now, we haven't really seen patients who contracted COVID infections over Christmas and probably having heightened mixing over that period. Those patients who are going to become seriously ill are going to become seriously ill over the next few days and are going to present to hospital. And I think the pressure is really extreme, and people are worried that they are not going to be able to provide good or adequate care. And the infection numbers today are obviously absolutely terrible and terrifying.
And how are you and your colleagues bearing up?
I think people are finding it really difficult. There's obviously high rates of staff sickness and isolation, and we went into this with a lot of vacant nursing and medical vacancies to start with. I think the other thing to highlight is just how sick these patients are. Patients on medical wards, it is really difficult to look after this number of sick people with normal hospital staffing. The level of acuity is much higher than what you would normally see, and so even if you were fully staffed how you would be normally, it's still very difficult to cope. And a lot of hospitals are not fully staffed, and people are working incredibly hard, and I think are struggling.
Do you and your colleagues also feel that people outside hospitals, the public, aren't really seeing what's going on and therefore don't necessarily fully grasp the gravity of the situation at the moment?
That's, I suppose, why we're trying to speak out about it. I've seen so many patients yesterday who said, been sat with people who are dying, who said, how did I get this? I thought I'd been really careful, with relatives of somebody who's dying saying, how did this happen? And the answer is, it is all around us. It's really prevalent. It's really infectious, and in a proportion of patients it causes really severe illness. And I think people need to understand what is happening in their local hospital, and the fact that if infection rates continue to rise, people will not be able to access good medical care, and we all have a responsibility to do everything we can from now on in to try to bring down rates of new infection.
And just briefly, are you and your colleagues also worried about getting sick yourself still?
People are really worried, and I think for people who have dependents or who have underlying health conditions or who are older, it's very scary. We have campaigned very hard in a continuing campaign to try to have the UK guidelines on PPE re-examined and revised. The level of protection that is mandated for most people looking after COVID positive patients is really low. We know that it affords some protection, but it definitely is not fully protective. And the staff working in intensive care units who had higher levels of PPE had much lower infection rates. Obviously they're doing more exposure prone procedures, but actually nursing staff on general medical wards looking after patients with coronavirus have very high levels of exposure, and we don't feel that they're adequately protected, and we feel that it needs to be re-examined as a matter of real urgency.
London Hospital Dr. Katie Sanderson.